Today we are going to demonstrate how we do the anesthesia for a cesarean section, which is commonly called spinal anesthesia and which is practiced worldwide and which is the best for the mother and the baby. Firstly, we make the patient sit on the OT table and we clean the back of the patient with a medicine called betadine, because sterility is very important in this procedure. And as you can appreciate, I am cleaning it from center to outwards so that the central part where we are going to inject is absolutely clean. Once it is done, we take the medicine, which is an unsterile ampule, so I have not taken the ampule in my hand and I am drawing it in a sterile manner. And once the syringe is ready, we need to clean this betadine also with a spirit solution. As you can appreciate that I am taking the spirit and I am going to clean this betadine completely, because this betadine can cause chemical meningitis if it is still there. So sterility is very important and we take due care, utmost care. Once it is removed by the spirit, see, this is how we dry up the area. So no traces of any medicines is left on the back and it is absolutely clean. This is a draping sheet which is again a sterile one, and this is how we apply it on the back of the patient so that the area where we want to inject, other than that, all the other areas are absolutely covered, as you can see, so that I can put hands on the shoulders of the patient or on the sides just to locate exactly where I need to inject. This needle which is in my hand right now is number 27, which is the thinnest possible needle available in our country. And it is very thin. It is thinner than the needles used by the lab technicians who come daily for our blood withdrawal. I am trying to palpate the space between the spinous process or the vertebrae, as you can call it, and I am trying to locate the exact position. For this, we just want the patient to be sitting relaxed, and this is what I am telling to the patient, to sit relaxed. And then I inform the patient the moment I am going to inject, and you can very well see the moment I injected, I have pierced the skin and the patient did not move, because we always explain the patient that it will just appear as an insect bite. Once the needle is in place, we see if the flow of CSF, the fluid that covers the brain and the spinal cord, is freely flowing or not. This is very important and a step. It has to flow freely, and you can see a drop of CSF falling down, and that tells us that the flow is free and it is clear, not mixed with any blood or anything else. Once we are sure that the flow is clear and free flowing, I attach the syringe, I aspirate so that I am doubly sure, and then we inject the medicine. The injection has to be pretty slow so that the drug stays where it is injected, because the level lower down this injection will become numb, which you are going to see in a short while. The patient doesn't feel anything unusual when the drug is going inside, but still we always inquire if the patient is comfortable or not. Once it is done, the needle is taken out and we remove this sterile drape that we had applied. And we put on a dressing, a sterile dressing, which can be removed a day after. After this, the patient is set to lie down on her back once again. We support the patient while doing so, and the job is done. अंजनी, कैसा लग रहा है? कोई प्रॉब्लम नहीं हो रही है? थोड़ा मुंह से बोलो जोर से।
नहीं सर।
दर्द हुआ जब हम सुई दिए? नहीं। और अभी पाँव थोड़ा भारी भारी लग रहा है? इसके अलावा कोई और प्रॉब्लम नहीं हो रही है? थैंक यू। अंजनी, कैसा लग रहा है बेटा?
ठीक लग रहा है।
आपका ऑपरेशन शुरू हो चुका है, कोई तकलीफ तो नहीं हो रही?
नहीं, कोई तकलीफ नहीं।
अच्छा। You can very well see the operation has already started. The patient is talking, she is comfortable, and the surgeons are also comfortable. The patient can't move her legs, lower down her waist. It's all numb. This is the IV fluid that we have to give. And see, the baby is already out, and the pediatrician is attending to the baby. Operation is still in progress. The mother is still very comfortable. And this is the monitor that we apply on every patient in the OT. On the topmost panel, you can see the ECG and the pulse rate. Lower down, it's the saturation, oxygen saturation. And further lower down, it is the blood pressure. Blood pressure is the only important thing that we have to monitor continuously. अंजनी, ऑपरेशन हो गया।
हाँ सर।
कैसा लग रहा है?
बहुत ज़्यादा अच्छा।
ठीक है, बेबी को देख लिए?
हाँ।
कोई तकलीफ नहीं हुई?
कोई तकलीफ नहीं।
चलो ठीक है, थैंक यू।